What's going on, YouTube? So today I'm going to talk to you guys about my emergency medicine rotation. Let's get to it. So my emergency medicine rotation was 5 weeks long with a 1 week break right in the middle of it. It was predominantly at a level 1 trauma center, and then we also did a couple things at a level 3 trauma center. So my shift work was just that. It was in shifts. So I would either be in the first, second, or third shift, 8-hour shifts. I would either start the day at 7 a.m., go to 3 p.m., go to 11, or 11 p.m., go to 7 a.m. I had like 50 or 60% were the 7 to 3, and like 20% were the 3 to 11, and then I had like a few nights where I did the 11 to 7, which those were rough, but those were actually maybe my favorite because there's less providers, there's less nurses, so I got to do a lot more during those shifts than say the 7 a.m. to 3 p.m. So like there's pros and cons to it. The caseload was a lot larger at night, even though they had less people working. And this also could be due because both hospitals I was working at had a shortage of providers and nursing staff, so the caseload was a little larger for everyone else. I saw anywhere from 3 patients to 10 patients, depending on the shift and depending on what the providers wanted me to see. Sometimes they would have me go in and see, a cardiac code where I got to just witness or help with CPR, which was the first time I've ever done CPR. So that was pretty wild. Super cool. Glad I did it once, never want to do it again, type of thing. Other times it would just be, a simple case where somebody comes in because they, fell off their bike and needed stitches. I did so many sutures. That was pretty much the role of the medical student. Everybody knew that. There's a suture case, where's the med student? That's basically how it was. So I did more suturing in emergency medicine than I did during my surgery rotation. So that was something I feel like I wish I would have been more prepared about before I would have came into the emergency medicine clerkship. Everybody was super nice for the most part, because obviously it's a very high stress environment during certain periods of the time. So just know that. So when you have patients, nurses, mid-levels, or attendings that aren't the nicest, I mean, that's just kind of the game you're playing. So be prepared for that. My school, my university, had us do so many patients per day. We had to do at least 3 patients in order for that shift to count. So I don't know what your university or program will have you do, but that was something that I had to be cognizant about, even though I always hit that easily without even trying to get patients. One thing I did not know that the emergency departments do is they have a cap on the number of patients they can have at one time, where they start to transfer or reject EMS calls. So if the emergency department is full, they'll actually shut down the emergency department to EMS, so EMS won't be able to come in. They call that standby or bypass, whatever your hospital calls it. Another thing that I thought was interesting is the emergency department a lot of times will turn into the overflow department. What I mean by that is the hospital will be so full upstairs that they keep patients in the emergency department. So there was times that the emergency department was 50% only for holding patients, for patients that needed to go upstairs. They were done with the emergency department, but they were just sitting in an emergency department bed because there was nothing else upstairs. The shelf that you take for emergency medicine, if your program decides to make you take the shelf, I know some schools don't have a shelf for the emergency medicine rotation. My school did, and I actually felt like the emergency medicine shelf was actually the easiest shelf I've taken so far. I felt like things are a lot more cut and dry, and there's algorithms, so it's easy to memorize information. And you can always take a step back and say, okay, what's the most important thing? Remember the ABCs, airway, breathing, circulation. And that, I feel like, was a large percent of the questions that I had, and it really helped me get questions right. It was the best I did overall on any of my shelves. I don't want to go into emergency medicine. I do have a little bit of background. I was an EMT in undergrad, so I do have a little bit of experience, but I don't think that really helped me too much on the shelf itself. It just was a talking point to the providers when you're sitting there for 8 hours with them. But other than that, if you have any questions on how the shelf went or what the rotation looked like or any study resources, definitely drop it down in the comment section below. Thanks for watching, and I hope to catch you next time. Thanks.